Hello, my name is Cameron Miller. I am a graduating senior marketing major from Richmond, Virginia, and the topic for my midterm is breast cancer. Breast cancer is a form of cancer when the cells in the breast area begin to grow out of control. There are a lot of research and statistics surrounding breast cancer, and a few are that 1 out of every 8 women is expected to develop breast cancer in their lifetime. 1 out of every 883 men is expected to develop it in their lifetime. There is an estimated 320,000 cases that will develop in the U.S. alone in 2020. There's an estimated 40,000 deaths that will occur due to breast cancer in the U.S. in 2020. And for women in the U.S., breast cancer has higher death rates than any other cancer. There is not one single cause or risk factor known for breast cancer. However, there are several different factors that may play into possibly getting breast cancer. And some of those are gender. Women are more likely to get breast cancer than men. Age, women over age 55 are more likely to develop breast cancer. Family history, women and men who have a family history of breast cancer are more likely to get it. Personal history, women and men who have previously had breast cancer are 3 to 4 times more likely to get it again. Exposure to radiation, along with all cancers, exposure to radiation increases the risk of getting cancer. Weight plays a factor in breast cancer. They've noticed that women who are likely to get it are more above weight, especially after menopause occurs. Race, white women are more likely to develop breast cancer. However, Black and Hispanic women are more likely to develop more aggressive cases of breast cancer. Other factors include hormone replacement therapy, breast feeding, pregnancy history, and genetics. While there is no 100% fail-proof way to prevent breast cancer, there are several steps that people can take to avoid and prevent getting breast cancer. And some of those are having a healthy diet and exercising, limiting alcohol consumption, not smoking tobacco products, which have been linked to all types of cancer. Breastfeeding, studies have shown that women who breastfeed have a lower chance of developing breast cancer, and the longer that they breastfeed, the lower that risk gets. Avoiding radiation and pollution, limiting hormone therapy, and having preventative surgeries. And preventative surgeries in this case would be removing the breast and having mastectomies. These happen in cases where people have a very high chance of getting it due to family history or due to already getting breast cancer in the past, and if they just want to completely avoid it happening, they just remove their breast altogether. There are 3 main ways that breast cancer can be early detected, and the first one are mammograms, which are low-dose x-rays taken of the breast. The second are clinical exams, which is where the doctor goes in and they feel their patient's breast for any abnormal lumps and growths. And then self-exams, which is the same thing, except for the women or men do the test on themselves. And the American Cancer Society recommends that women between age 40 and 44 optionally but are recommended to have a mammogram every year. Women ages 44 to 54 are strongly recommended to have a mammogram done every year. And women that are 55 or older are recommended to get several mammograms a year, since the risk of breast cancer increases with age with women over the age of 55. There are several different variations of breast cancer. However, some of the most common signs and symptoms of the disease are lumps in the breast, discharge from the nipple, changes in breast shape and appearance, swelling in different parts of the breast as well as the nipple, irritation, aching, rigid skin, inverted nipples. There are lots of other signs and symptoms such as wet redness, sensitive nipples and breasts, swelling and lumps in the lymph nodes, which are under the underarms, since they are linked to breast cancer as well. And there are a lot of other symptoms as well. There are 4 main ways that breast cancer can be officially diagnosed, and the first are through ultrasounds, which give a detailed picture or a sonogram of the inside of the breast. mammograms, which give an x-ray of the breast, MRIs, which also give a detailed picture of the breast, and biopsy, which is when the doctors go in and they remove pieces of the breast tissue and they examine it under a microscope to see if there is any abnormal and unusual growth. There are 5 different stages of breast cancer, ranging from stage 0 to stage 4. And in stage 0, that is when there are no cancerous cells found and the breast cancer has not yet developed. And then it increases to stage 1, which is broken up into stage 1A and 1B. The next step is stage 2, which is broken up into stage 2A and 2B. The next is stage 3, which is broken up into stage 3A, 3B, and 3C. And the last stage is stage 4, and that is in just one stage, and that is the most invasive and aggressive kind of cancer. And that means that the cancer has spread beyond the breast and the nearby lymph nodes, and then it has reached the other organs such as the lungs. And at this point, the cancer is considered advanced, and there is a very low survival rate of stage 4 breast cancer. There are a lot of different factors that affect the survival rates of breast cancer, such as age, gender, race, and weight. However, the National Cancer Institute releases information from their SERR database, which is based on the location of breast cancer within a 5-year time period. So the 5-year survival rate for localized breast cancer is 99%, and localized means that the breast cancer has not yet spread outside of the breast. There is a 86% chance of survival for regional breast cancer, and that means that the cancer is still in the breast and has spread to the lymph nodes as well. And then there is a 27% chance survival rate of distant breast cancer, which is when the breast cancer is in stage 4 and it has spread outside of the breast and lymphs to other organs. And then the overall rate of survival rate of breast cancer, combining all 3, is 90%. There are several different ways to treat breast cancer. One way is through therapy, and there are multiple different types of therapy. Chemotherapy is when they use technology to shrink the size of the breast cancer cells in hopes that they will eventually eradicate themselves. Hormonal therapy is when they block the hormones that the cancerous cells need to grow from entering your body. Biological therapy helps the immune system fight off the cancerous cells and helps control the side effects of breast cancer. And radiation therapy is using high energy rays that will kill the cancer. There is also surgery as an option, and that is when they go in and they completely remove the breast tissue to avoid cancerous cells spreading to the rest of the body. There are clinical trials, and clinical trials are basically when new drugs and methods are developed by doctors, and women and men are able to opt into these clinical trials to see how well it works. There is always a risk of death or adverse effects or it not working at all, which is why they are trials and why they are voluntary for women to enter. And then there's also alternative methods and medicine. These are things that people believe to work, however, they have not been scientifically proven. And that concludes my presentation, and the last slide is the references that I used to collect all of my research for this presentation.